It is a condition leads to blood clots that forms in the deep veins of legs. Here VTE leads to DVT plus pulmonary embolism. Here VTE, deep vein thrombosis and pulmonary embolism leads to venous thromboembolism. Here coming to complications of venous thromboembolism is pulmonary embolism, where blood clot which is formed in deep veins of legs transfers or circulates in the blood and flow to lungs. Here this clot formed in the veins moves to the lungs with the blood circulation. After going to lungs, it cannot we cannot breathe. There is a shortness of breathing problem. And coming to signs and symptoms of venous thromboembolism, swelling, we can see swelling of legs, redness or puffness of legs, shortness of breathing. Risk factors for venous thromboembolism are pregnancy, people or persons who are undergone recent surgeries, alcoholism, smoking. These are the risk factors of venous thromboembolism. While coming to treatment of this venous thromboembolism, we can use many medications like paracetamol, we can also use spironolactone. It is a diuretics, and heparin it belongs to class anticoagulants. Warfarin, it is also belongs to class of anticoagulants. And pantoprazole it is belongs to class proton pump inhibitors. Diagnosis of DVT, diagnosis of this venous thromboembolism, or we can go for many tests like D-dimer test, CT angiography, and ultrasound. These are all the tests we can refer for this venous thromboembolism. And signs and symptoms are like legs will become swell and red. Patients cannot walk or move, and mostly this condition is seen in persons with high fat cholesterol and people who cannot move and sitting for long times in same place. This is it occurs mostly in age of above 70 years, as they cannot move, or they have any surgery problems or spinal cord problems. As they cannot move, they are prone to this disease. Complications. Coming to complications, this venous thromboembolism is DVT, deep vein thromboembolism, is a complication for pulmonary embolism. Here blood clot, we can see here blood clots are thrombus and embolism. Here embolism is movement of blood clot from one place to another, and thrombus is forming of blood clot and staying back there itself in one place. Here embolism can travel from one place to another. For example, the blood clot which is formed in deep veins of legs can travel to lungs in blood circulation through veins, and they will form or lodge in lungs. So where lungs cannot where this person cannot or able to breathe, or symptoms we can see are shortness of breathing, etc. Patient counseling. Coming to patient counseling for deep vein thrombosis, legs, as their legs become fat, they should elevate the legs. That means they can keep their legs properly, and they should also walk for some time. They should always follow the regular exercise. All this we should see in this deep vein thromboembolism patients. They should also take their proper diet regularly, etc. Person who have habit of smoking or taking alcohol, they should stop all this.